Hello viewers, welcome to Medico Virally. Today we are going to start a lecture series on CNS pharmacology. Today we will be discussing about sedatives, hypnotics. What exactly is sedative? Sedative is a drug which decreases the activity and moderates the excitement. Whereas hypnotic means they produce the drowsiness. They facilitate the onset of sleep. So sedation decreases the excitement levels. Hypnosis induces the sleep levels. Okay, so when the drugs are given in low doses, they cause sedation, and when drugs are given on high doses, they cause hypnosis. H and H. So both these, they work under common mechanism, that is they depress the CNS. How exactly they depress the CNS? We have a simple mechanism here. This is, suppose this is a cell from the brain. We have these chloride ions and chloride channels. When the GABA A receptor is stimulated, the channel opens and the chloride enters into the cell. This chloride depresses your CNS. In the same way, we have barbiturate and benzodiazepine receptors too. So when you give these barbiturates or benzodiazepine drugs, they bind there and they also act as GABA, and they facilitate or they mimic the GABAergic action. Okay, here I just make a simple story for you to better understand it. That is, I compare the barbiturate to a bar. So many of alcohol, wine is present. Here I compare the benzodiazepines to the Benz car. So let us understand a small story here. You have a bar which is located far from your home. You don't have any personal transport. You don't have any bike or car to reach that bar, but you are fond of alcohol. What happens? Occasionally you can take some of the public transport, and occasionally you reach the bar and have your party, right? But when you go occasionally, you intend to stay there for longer duration of time, and you get addicted to that. But after a few years, suppose you bought a Benz car, and now that you have your own transport and you intend to go daily, so here the frequency is increased. What exactly your Benz car did? The Benz car facilitated you to go to the bar frequently. So let us apply the same story in understanding the differences between the barbiturate and the benzodiazepine. Here the barbiturate, they exactly work as GABA. So they are called as mimetics. And benzodiazepine, what did I tell you? The Benz car facilitated you to go to the bar. So it acted as facilitator. It acts as the facilitator of GABA, right? And when you didn't have the personal transport, you went to the bar occasionally, but whenever you went occasionally, you spent longer duration of time. And in that way, you can remember the duration of chloride channel opening is increased with barbiturates. You have to understand about the DRC. What exactly is DRC? It is a dose response curve. Whenever this dose response curve is steep is nothing but maybe something like this. So if this dose response curve is steep, then these drugs are unsafe or they are toxic at higher doses, right? But the Benz car or benzodiazepines, the DRC is flat, and hence they are more safe when compared with the barbiturates. And these barbiturates are enzyme inducers, and that's why they have many of the drug interactions. And Benz car or benzodiazepines, they are not inducers and no interactions. And what did I tell you? You are very addicted to the bar, right? And that's why there is more addiction with the barbiturates and less with the Benz car. Whenever you go to a bar, what happens? The next morning your friend wakes up who took the alcohol, lots of alcohol before night, and he just tells you the same dialogue. What happened the last night? What did I do? What exactly is it? Yeah, it's amnesia. That means loss of memory, for your temporary memory. So that amnesia is lot with the barbiturates and amnesia is less with the benzodiazepines, right? There is no antidote for the overdose of barbiturates, but if the benzodiazepines are overdosed, we have an antidote named flumazenil. How can you remember this exactly? From the word benzodiazepine, take this PINE. So spell it in Hindi, पीने, पीने का मजे, nil hota, right? When you give this flumazenil drug, this maze will be nil, right? This is the way to remember the antidote of benzodiazepines. And let us see what are the main drugs in the benzodiazepine groups. We have few drugs named diazepam, flurazepam, nitrazepam, and flunitrazepam. There is a problem with these drugs. I gave a diazepam to a patient to seduce a patient, and I expected the patient to wake up after 6 hours. But even after 6 hours, the patient cannot wake up. he's still asleep. Why? Because after 6 hours, the diazepam was metabolized and an active metabolite was formed, that is oxazepam. Even this active metabolite produces the sedation further for 6 more hours. So the total duration is 12 hours of sedation is produced. It's all the same with all these drugs also. So what can we derive from this concept? That is, these benzodiazepine drugs, they are long acting and they are metabolized especially in the liver, and due to this long acting, hangover occurs with these drugs. Just like when you have lots of alcohol and the next day morning you have a hangover, right? So this is the same case with benzodiazepines. And as there is a metabolism, as these drugs, the metabolism occurs in the liver, these drugs are contraindicated in liver failure patients and also with elderly patients, because elderly patients are sensitive with CNS drugs. So we have all these problems with benzodiazepines. What can we do? Yes, we have found newer drugs where there is no metabolism into active metabolite. So these drugs do not have any active metabolites. So whenever you give these drugs, they act only for shorter duration. And the name of these drugs can be remembered with the mnemonic STOL. Here, short-acting benzodiazepines, and T for thiamazepam, oxazepam, lorazepam, estazolam. So what can you derive from all these drugs? They are short-acting, they don't have hangover mechanism, and they do not have these active metabolites, right? So let's go into the next slide. So what exactly we are trying to do? We are trying to induce sleep. So do you know the mechanism of sleep? I think it will be discussed later in physiology. The exact physiology of sleep will be discussed there. But right now, let us just have a broad idea about that. Is for a good quality sleep, there are mainly two phases, REM and non-REM. And in non-REM, we have 4 phases. So each of these phases has its own importance. So when everything is normal, then we call it as good quality sleep. But when the patient with insomnia, what is exactly is insomnia? Unable to sleep, right? So in these patients with insomnia, when we try to give these barbiturates or benzodiazepines to induce the sleep, what exactly is happening here? Is there any problem with these drugs? Yes, there is. So benzodiazepines or barbiturates, they increase any of one phase, they increase the duration of any of one phase of the cycle. Suppose, hypothetically speaking, the duration of REM is 15 minutes and first phase of non-REM is 10 and second 20 minutes, third is 15 and 4 is 10 minutes. When we give these drugs, for example, the second phase is increased to 40 minutes. Just a second. The second phase is increased to 40 minutes. What exactly happened here? The duration is increased, that is the quantity is increased, but the quality of sleep is compromised and the sleep architecture is distorted, right? And another concept you have to understand with these drugs is the latency of period. For example, in a normal patient like you or me, in a normal people, when we try to sleep, after 10 to 15 minutes, we fall asleep. But in patients like insomnia, when they try to sleep, even after 1 to 2 hours, they couldn't fall asleep, right? So this duration is known as latency. So even these barbiturates and benzodiazepines, they decrease this latency period to here. From here, it goes up to here. So the latency is decreased, quantity is increased, but quality is compromised. So even if you sleep, but after waking up, you feel like, oh, the sleep was not sufficient for me. So this dialogue is mostly associated with these drugs when given to insomnia patients. How can we solve this problem? Yes, we have come up with a newer drugs, that is non-benzodiazepine drugs, also known as Z drugs. The names are zolpidem, zolpiclone, zeleplone, and zopiclone, the isomer of this is S-zopiclone, right? So these Z drugs, they decrease the latency and there is no compromise with quality and quantity. There is sufficient quantity and there is a good quality of sleep also. And they are non-addictive and there is no hangover with these drugs. In the earlier before slide, what regarding the side effects of benzodiazepines, there was a hangover, right, due to this long acting, due to those active metabolites, and even there is an addiction also. Up to some extent, the patient becomes addicted to benzodiazepines too, right? And this isomer of zopiclone, you have to remember one special point here is the S-zopiclone, they stimulate only one subunit of benzodiazepine receptor, that is alpha 1 or omega 1. And this S-zopiclone, they only decrease the latency and there is no compromise in sleep quality or quantity. But When compared with these other drugs, the S-zopiclone, there is no anti-anxiety or muscle relaxant or anticonvulsant properties. But rest of these three drugs have these properties. That is the difference. And S-zopiclone, it doesn't produce sedation, it produces only hypnosis. So it has only hypnotic property. And as these drugs act same as like GABA receptor, at the same receptor, even we can give the same antidote for this drug overdose also. For example, if you have a patient with zolpidem overdose, you can give the same antidote which was given for benzodiazepine overdose, that is flumazenil. Right? Hope everything is clear up to here. And regarding the sleep, how exactly we are sleeping only at night times? Because there is a hormone named melatonin which is released from the pineal gland. This melatonin is mainly secreted during the night time, and this produces that sedative effects. Okay, but in few situations there is a need to change this melatonin release in conditions like night shift workers or night duty workers. So these people need to be awake in the night time and they want to sleep in the morning times. So the melatonin must be released in the morning time for these people. And in people with jet lag is nothing but like for when you go to America from India, you go to America, there is a difference in time, right? Here we have a day and there it is a night time. So even there we need to stimulate this melatonin in different times. So for that we have one drug, that is Rameltion. It is a melatonin receptor agonist or activator. You can remember it by the name also. Melt is melatonin and on it is it activates, that is receptor agonist. Okay, and you can, if you go in this reverse direction, it is non-addictive. You can remember it as non-addictive, and this metabolism occurs with microsomal enzymes, and hence there are drug interactions with this Rameltion. Another point is Rameltion has very less oral bioavailability. It is less than 2%. During the daytime you are awake, so this awakefulness is stimulated by orexin receptors. Whenever these orexin receptors are stimulated, you stay wakeful. Okay, you are awake. For example, in insomnia patients, the main problem may be the orexin receptors are stimulated all the time, and that is why they couldn't fall asleep. So in one way, if we can block these receptors with the help of the drug suvorexant, then we can cause sleep in the insomnia patients also. So you can remember this suvorexant, the name of the drug, that is Orex, that is orexin receptor antagonist. Okay, so these are all the names of the drugs and important mechanisms regarding the sedatives and hypnotics. So a quick review regarding the lecture. Sedative drugs like benzodiazepines or barbiturates, when given in low doses, causes sedation, and when given in high doses causes hypnosis. Both work by depressing the CNS and with the help of this chloride channel. Just remember barbiturate as a bar and benzodiazepines as benz, and remember that story. The barbiturates or mimetics and your benz car facilitated you, and your benz car increased your frequency of visiting the bar. And also there is another mnemonic here, that is all of the benzodiazepines, you just remember the letter F here, right? That is, it is a facilitator, it increases the frequency, and the DRC is also flat. And few important points you have to remember regarding these also. And the main point, that is the antidote of benzodiazepine is flumazenil. Even this same antidote we can give for non-benzodiazepine drugs also, the Z group of drugs also. And regarding the benzodiazepines, major side effects was that they are long acting and they have hangover, and you cannot give in a liver failure patients. That's why we found these newer group of drugs, Stol. You can remember that with that mnemonic. And later we discussed about the sleep, like barbiturates and benzodiazepines. They distorted the sleep architecture, they increase quantity, decrease the latency, and compromise the quality of the sleep. So we solved this with the help of the Z groups, where there is no disturbance with the quality and quantity of the sleep, and faster onset of the sleep, and no addiction, no hangover. And an isomer of the zopiclone also, we discussed all few important points about it. Okay, and regarding the melatonin and orexin, you have to block it, melatonin you have to stimulate it to induce the sleep. That's it. Hope everything was clear, and if there is any doubt regarding this concept, kindly feel free to comment in the WhatsApp, or also you can comment below in the YouTube comment section. And if you want to join the WhatsApp or Telegram, you can click the link below, which is provided in the description. If you like the video, kindly subscribe and hit that bell icon for instant upload notifications. Kindly do share to your friends if it is useful. Thank you very much.